As major partners in this year's Suicide Prevention Australia Symposium, Safeside invited delegates to ask questions about suicide prevention, and we do our best to answer with a personalized video reply. Damien took us up on it. Damien's a thoughtful clinician who has lived experience of suicide bereavement, and he shared this important and heartfelt question.
As a mental health clinician with a lived experience of suicide bereavement, it seems to me the suicide prevention field most often focuses on building the capacity of services. In addition, there is a focus on the importance of involving existing personal networks where possible in a person's treatment and support. Fortunately, my family member reached out to family, friends, and his treatment team at times. However, like many others, he tried to be too independent and eventually suicided. Since then, I've increasingly found it useful to encourage family and friends to be a bigger part of my patients' therapies. Once or twice, I've also breached confidentiality when the risk seemed too great not to. I'd like to ask the panel to please reflect on how to best engage social networks in therapy. Thank you.
Hi, Damien. Thank you for your thoughtful question and for sharing your lived experience. I'm so sorry for your loss. Suicide is so tragic. And the situation where you described how your family member was getting help and reached out when they could, it feels just especially painful. I'm also a clinician survivor with loss in both my personal and professional life. And, like it sounds like you're doing, those experiences shape my work as a clinician. And I hope I provide better care as a result of that. There's a member of our team that I'd like you to meet. Her name is Mel Clark, and she's the program coordinator and family advocate at Safeside Australia, who's also a family carer. So let me let her introduce herself. I know she really appreciated your question, and then I'll continue.
Hi, Damien. Mel Clark, family advocate and program coordinator for Safeside. Firstly, I'd like to thank you for asking such an important question, and I'm genuinely sorry about your loss. Thank you for your presence at the Suicide Prevention Australia Symposium, and I'd love to connect with you, so come over and see us at the exhibition booth. To your question, as a carer, this is a very important question that I find myself advocating for all the time. I've spent the last 7 years advocating on behalf of my brother and on behalf of other local families who are asking the same thing. How do we involve family inclusive practice? I know that as a family member, it's deeply important to me that we find the right answer, that we work together and that we collaborate as systems, as local health districts, as primary health networks, as families, as individuals, and those with lived experience play such a huge role in pulling all of this together. There has been no greater time than right now that we are hearing executives and leaders in this field saying, let's use lived experience as the missing component that we've had. I really hope that our Safeside team can provide you with some insight and answer your question a little bit more. It's been a pleasure talking with you. Hope to see you soon.
Thank you, Mel. To the substance of your question, how do we think about involvement of a person's family and social network? We have a saying around here, almost any problem becomes more manageable when you have a framework for understanding it. And our work and thinking is shaped by the Safeside framework for recovery-oriented suicide prevention. And this framework involves 4 core tasks: connect, assess, respond, and extend. If you're interested in an overview of the framework, we'll provide a link in the description notes below. In our framework, there's a role for family across all tasks. In Connect, in fact, one of the first foundational principles is to collaborate early and often with family members. And as you can see from the lines that extend in this diagram across all the other tasks, these collaborative principles, extend. This is not a linear thing where you do the connecting and then you go on to the next phase. There's always a role for the family members and other supports, provided the person will let them in. And there's even steps for helping that happen more. There's a role, for example, of family in assessment, especially in the identification of foreseeable changes. If you go to the delegate resources that we provided for Suicide Prevention Australia, Damien, you'll be able to find a mini module where you can learn about foreseeable changes. We'll also link to that below. Where I'd like to focus in answering your question is in the respond and extend tasks. Extend refers to how we extend the impact of our work with individuals struggling with suicide concerns beyond the individual, beyond our programs and facilities, and into the person's life and network. So that kind of gets exactly at your question. And I think the best way to provide you a useful answer, Damien, is to share a couple of excerpts from our video-guided workshop. The first one I'll share with you relates to the use of a family support plan. Watch this.
One way to ensure families have clear roles is to develop a family support plan. Family support plans present the content of your safety plans from the point of view of a family member or other central support persons. In other words, you take each of the elements of my safety plan and write it so that my mother knows what she should know or do to support each one, and when and how she can connect with my team if it looks like my plan isn't working.
For example, if you're using Stanley and Brown's safety planning intervention, you've probably identified social strategies for distraction and support. For a young person, what is their parents' role in that? To remind them? To drive them? Hopefully the plans have been developed already with family input and involvement. But even when time or circumstances did not allow extensive upfront involvement, you can still make a support plan part of your routine so that you always have both. And at whatever interval you normally update your safety plans, update the support plan too.
Involving family and other support persons is not an all or nothing proposition. Some is better than none, and a little can lead to a lot.
Is that helpful? Damien, I wonder if you've used a family support plan before. If you haven't, we're interested to hear about it. And if you haven't, give it a go and let us know. An additional thing I would add about this is that truly involving friends and family is sometimes easier said than done. It sounds like in your situation, family members and others were really available, able to be involved, and at least at certain points, the person was able to let them in. The most common objection our team hears when we advocate for extending our impact into the person's network is that the family doesn't want to be involved or they're too difficult. We address this in our video guided program as well. So let me show you a clip about that because I think it's hugely important. Family and supports are involved in every core task of our framework, from connect to respond. In extend, we focus their input, developing shared plans and having clear roles for supports and providers. Involving family and supports is incredibly important, but it can also be challenging in some circumstances.
Let's look at a few of those challenges and how to overcome them. The first challenge is that family members struggle too, and they're not always equipped to help or easy to get along with. It sounds nice to consider family as part of the team, but what if family members' own struggles make them unavailable or even toxic? A second challenge is that some youth and adults don't want their families, or anyone else for that matter, involved and informed. What can we do then? Including when we have legal requirements to inform. There are a few principles that can help here. Assume good intentions, widen the circle, and widen the options.
Damien, thank you again for your question. I hope some of this is useful and relevant to you. Please keep in touch and let us know what you're learning as you continue this work too.